Hi, Dr. Becca here with Del Mar Center for Behavioral Health. Today I have a short video about the ADOS 2, or the Autism Diagnostic Observation Schedule 2nd edition. This assessment was created by Dr. Catherine Lord and her colleagues. That's currently on its 2nd edition. The ADOS is often considered the gold standard for diagnosis of autism spectrum disorder, or ASDs. It's also important to note that it is not the only assessment used in diagnosis, and that diagnoses typically are not made off of one instrument or one measure. And so it's important that when getting an evaluation to rule out ASD, that there are a variety of different measures used to help rule out a variety of different disorders, as many disorders share similar symptoms. So a little bit about the ADOS. It is a semi-structured set of activities, and that means that there is some structure to it and some not structure to it, which means that there's some flexibility, which is great in that it allows us to modify slightly the tasks to best fit the individual that we're assessing. The challenge is that we can and have to modify the presses, they're called, the different activities for the different kids that we might be assessing. It's not an assessment in the sense of a cognitive or IQ assessment that we've talked about previously, where you're showing the child a set of pictures or asking them to do a set of tasks. It has a variety of different activities that are set up to elicit some of the behaviors that individuals with ASD struggle with. There are different modules. There's 5 modules of the ADOS, and the modules means different levels. So there's a toddler module, which you use for toddlers. Then there's module 4 that you use with older adolescents and adults. And then there's module 3 that you use for young adolescents and kids that have phrase speech, right? There's a module 1 that you use for kids without language, and then a module 2 for kids with minimal language. And so these different modules have different activities that are part of them that are appropriate for the different skill level of the different kids. I think that's saying different a million times. But what it means is that there is a set of presses or a set of activities that are most appropriate for different skill levels and different ages, because the symptoms and behaviors associated with autism present differently at different ages and skill levels, which is why it's called a spectrum disorder, right? So a variety of people can have the same diagnosis and have similar or even very different symptoms and behaviors that are manifestations of that clinical diagnosis. The ADOS typically takes an hour to administer. There's a lot of writing on behalf of the administrator, and there is a formal training process that's part of being appropriately trained to administer the ADOS. You might have somebody helping you, whether it's for a learning experience or to help code and take data while you're also taking data, or the clinician's taking data, to be sure that you don't miss anything. Because it isn't as easy as just a correct or an incorrect, that on some of the other measures, there'll be, if so-and-so says this, then it's 1 point. If they say anything other than this, it's 0 points. It isn't quite that clear. We're taking qualitative information and then assigning that a number. And because it's not as straightforward, again, that training requirement is super important to go to there are 3-day trainings, some are even longer, and be truly trained in the administration by those who are approved trainers. Again, the ADOS is considered the gold standard. It's appropriate for kids and adults of variety of ages and ability levels, and it is one component of a thorough autism evaluation. Again, it is a semi-structured set of activities that are set up to really elicit or bring about those behaviors that are often associated with ASD that are sometimes hard to see in a snapshot. And so the purpose of the sequence of activities is to essentially set up the individual being assessed so that some of those difficulties, if they're present, will be seen and can then be coded by the administrator. Hope this was helpful as you guys are navigating the world of autism and clinical psychology and behavior analysis for yourself or your kids or kids that you know. If you have any questions, let me know and I'll address them in a future episode. Again, I'm Dr. Becca with Del Mar Center for Behavioral Health, and I appreciate you watching this video. Have a great day.